Memorial Care is a 5-hospital system with about 3,000 independent practitioners. We are absolutely wholly dependent on these physicians to admit to our facility. And we're working very hard to integrate the EMRs in the physician offices with the EMR inside our facilities. We know this really matters to them. We know it's important to patients. We know it really matters with respect to quality. With Accents, we can connect to any EMR system through the services that they offer.
The exchange has allowed us to focus on the waste in healthcare, and the healthcare dollar is so valuable right now. And when you can eliminate an extra test, or you can eliminate something from happening to the patient because it just happened 2 days ago, but that provider didn't know about it, or that ED physician didn't know about it, that's when you've really won.
We start by creating a platform with interconnectivity services. And what that means is being able to take clinical information or any other type of information and be able to help Memorial Care distribute that. We provide information exchanges to practices that might have an EMR or practices that don't have an EMR. Accents provide a strategic partnership to the health systems to develop a stronger bond with the physicians.
It's easy for our staff to employ in a variety of physician practices, so we don't have to make lots of adjustments depending on what EMR is in a physician's office. So it's a fairly low-cost solution for us in terms of being able to connect a variety of physician office systems, or just to offer them portal services.
We've been waiting 7 years for an interface with our EMR to your inpatient EMR, and we've gotten that in less than 4 weeks. So it's been pretty amazing, the response that we've gotten from the physicians. It brings the reputation back that you can do what you say you're going to do.
Physicians want to spend their time with patients. They don't want to have difficulties with respect to connectivity. They want to have access to information, and they want it to be easy. And Accents gives us the ability to provide information to physicians in a straightforward and simple to use manner. The Accents physician outreach team works directly with our clinical training specialists, the individuals that are dedicated to helping physicians in their practices. And together with Accents, this forms a very, very powerful team that basically represents us to our physician practices.
They, over-deliver every single time and are keeping my team in the loop, so that way they're not taking over a relationship, but they're enhancing a relationship and really, truly a partner in this process.
So we expect the stimulus package to accelerate the adoption of EMRs. And that's going to accelerate our need to reach out to physicians. It's actually going to make our lives easier. And the Access platform, the Accents professional physician services, along with our team, will allow us to put together a real strong outreach program.
What's happened since the implementation of Xenix, it has been a real godsend for our physicians in terms of lack of extra effort and time, copying over results that are already present seamlessly. They are appearing into our medical record, and now our notes will be seamlessly transferred into our hospital EMR as well.
By having this exchange in our office, we get results much quicker. If a patient happens to drop in unexpectedly, we don't have to wait on the lab results. We can pull them right up. It's also helped the patients in that oftentimes we don't have to redraw labs that we haven't gotten the results for. We can just go in and find the latest information. And so in a number of ways, it's helped speed up our care and make it more efficient.
Accents gives us a platform to offer a variety of services, to provide connectivity to the EMR system that we use in-house, to provide connectivity to an EMR system of their own choosing that they may already have in place, or to provide results out to their offices from our reference lab, for example. And so we're able to privately brand this set of services from Accents and come up with a Memorial Care portal.
Prior to the implementation of Xenix, we basically were working with two different EMRs. Our company has one proprietary EMR into which our physicians were having to duplicate the lab results that were coming into our hospital EMR and then cut and paste and transfer that subsequently into our hospital's EMR.
By putting in this health information exchange, it's really made it so that we can give more rapid care to the patients, as well as not have to repeat a lot of unnecessary tests.
Accents gives us a powerful system at a very reasonable cost that we can roll out incrementally as our physicians begin to adopt these kinds of technologies. So it's a pay-as-you-go kind of strategy.
Accents has allowed us to start a project without having to go after capital because it's very little money up front with implementation, and it's the pay-as-you-go.
I mean, there's a reason the government is supporting information exchange, and it's a strong belief with the evidence that's now emerged that exchange can improve quality and help lower costs.
And Accents, I think, has taken away a whole dozen of no's that we've had to say in the past and allows us to say yes much more frequently. And it doesn't really have an impact to resources or capital or any of those things that you're fearful of when you're in a healthcare environment.